Welcome to third trimester. This marks the beginning of the end of your pregnancy journey, and it is so exciting to start the countdown from here. So, what are the things to expect during third trimester? Actually, third trimester has both symptoms and body changes, but then third trimester leans more on the body change part more than the symptoms part. Before we go into that, welcome to Pregnant Care here. I prepare you for what to come during pregnancy and I walk you through it. So if you want simplicity and not too much science, you will be in love with this channel. So please click the subscribe button to subscribe to this channel. Like this video if you do when you're done watching. And I'll watch what is motherhood activated, patience activated, love is all we need. Let us go into it. The first symptoms I'll be mentioning for third trimester is heartburn. Now your baby is bigger and you have tendency of eating foods that will not really stay in the tummy. Not like they won't stay in the tummy, but because the baby is occupying most of the spaces in your tummy, because of that, your food won't just go in and rest well. Now, this is the major cause of heartburn. Now, what can you do? When you eat, try to sit up straight for a longer period of time so that the food goes down well, and try to eat in bits. If you can eat in bits, you can try to eat in bits. Don't eat too much so that it won't the acid reflux won't keep coming back. Or you can keep taking water. Every time you feel the sensation, just take water. Or you can eat fruits like banana, watermelon to just help reduce the intensity of this heartburn. Another symptoms for third trimester is constant pain. Now, the baby is bigger, like I said, and is resting on your bladder. So your bladder is not having enough expression and space. Now, the little space in your bladder, the moment you feel like peeing, the moment pee starts to form, immediately it sends signal that you should go and pee. Why? Because it doesn't have so much space to take a lot of pee before you eventually go and pee. So because of this, you have to go to pee almost every time, almost every time. Actually, this particular one usually starts from first trimester for some people, but not everyone. There are some people that this majorly starts for them at third trimester. It depends on how your bladder movement has been earlier before now. Still talking about consistent pain, there's something called pee leak. I've mentioned it earlier in one of my videos. Now, pee leak is that situation when the bladder doesn't just have the energy at all to keep the pee, so it just bursts out itself. You are not in control of it. This can happen to pregnant women. So if it happens to you, don't be too afraid, don't be too surprised. It's just one of the symptoms of third trimester and it's fine, it's okay. Just wash yourself up and you'll be fine. It doesn't happen regularly. It can happen once, twice. It's not like it will keep happening. It's just take it like probably someone has always offended someone, but the person used to keep it before lashing out, keep it a little before lashing out. But this time around, when the person is just come, the person just lashed out immediately. Just leave me alone. Exactly, that's how pee leak is. It's just that immediate response. I don't want to keep this pee. Just get out. You people should go out. Exactly. So you'll be fine. Another thing to note during third trimester is Braxton Hicks. Now, this is a contraction in your tummy in preparation for delivery. Now, this happens when towards the end of third trimester. So you keep having that squeeze and release, because there will be a lot of contraction during your delivery, so during your labor, so the body starts preparing for it in advance. Now, this Braxton Hicks can come with some kind of crutch and lightning in your in your bosom, and you just feel it like, oh, something is going on. Exactly, don't be scared. It's just part of your body preparing for the delivery, the labor and the delivery. Another thing about third trimester, this one is a personal experience, carpal tunnel syndrome. This has happened to quite a lot of women that I know about, but not like everyone. This one is a chosen symptoms. It's not really it doesn't really just happen to everybody. It's just few. Like I said, pregnancy differs from person to person. It may happen to you, it may not happen to you. It is carpal tunnel syndrome, and this is when your wrist just becomes, should I say, inflamed from inside, and this will start causing pain. And now, over time, a bone structure starts to grow from that wrist. It's actually happened to me, so that is why I even know about this particular one, because I've never heard it from anywhere before. So when it happened to me, I started researching on it before I knew that, oh, it came with pregnancy. I didn't even know that it's because of pregnancy, because I was like, what's all this? It happened to me while I was sleeping. I just woke up and I felt like a strange move in my hand, and that was all. It wasn't because I hit it on something or anything. So this carpal tunnel syndrome will go when you give birth. For some people, it went when they give birth. For some people I know, it went after they were done breastfeeding. But for me, it went after a very long time because I was still breastfeeding and it went on its own. So it's okay. Like I said earlier, what happens the most during third trimester is body change, and we are still going there. Before we go there, have you subscribed to this channel? Please do well to subscribe to this channel. Thank you. Now let us go to body changes. The first one I will add, it's more like a body change and its symptoms, is swelling of your legs, ankles, your joints, your feet. Swellings is usually happen a lot during third trimester, and mostly when you are not resting, you're working yourself, you're stressing yourself. It happens a lot, and it's just prepare for swelling if you're not resting. But some people who rest, you still have it, but just that the tendency at which it gets swollen when you're resting is not as much as when you're busy. Now let us go fully into the body changes of third trimester. Let me start from pimples. I've spoken about pimples in the first trimester. Yes, you get to have it, but the one that beseech, the one that is going to come the third trimester, oh my god, is like, now we are getting ready for delivery, let us just attack more. I don't know, I'm just kidding. But then it's usually bigger, more, it becomes more pronounced. It's now all over the face. Some people have eczema, it depends on your body. Some people have eczema, some people have just swollen face. Their face should be swollen, more like there are boils on their face. It depends. This is also when the body pigmentation happens, like the blackening of the neck, all this body pigmentation, the face, the blackening of the face depends on your body type. Of course, your tummy gets bigger, and now that your tummy is way bigger now, because tummy usually increases drastically from 6 to 9 months. Now, during this process, your stomach is expanding. This expansion usually leads to stretch marks, and it's so for some people it may not happen to them, because for me I didn't get much of stretch mark actually, but for some people it happens. It's just your body expanding. Now, your nose can become big, very big, extremely big, mediumly big, a little big. It depends, but there's a chance that you have an increased nose. During this time, you need to even exercise the more. We are still going to talk about the types of exercise to do as a pregnant woman, but you need to exercise the more because now you have to prepare for delivery. Now, some other things in third trimester includes, there is a belly carrier you can get if your baby bump is so big and it starts having pain, it start giving you pain on your back, because these things happen in third trimester when your baby is now bigger and now the weight has fallen on your back. So you can buy a belly carrier, and this carrier will make the weight way easier for you and better for you. Now, another thing you can buy to make some things easy for you during third trimester is pregnancy pillow. Now, talking about pregnancy pillow, during third trimester begins the quest for sleeping position. Left or right, where should you sleep? My sister, sleep anywhere you want to. Yeah, the physicians have come together and they said, okay, you have to sleep on the left side. It is fine if it's comfortable for you. It is okay. But for me, it wasn't, because I kept trying to sleep on the left side, and no, and I wake up either on my back or on my right side. In fact, and because of this, the moment I wake up, I have intense fear that, hey, I'm not sleeping on my left side. Now this fear that I started having constantly was bad for me. I had to work on myself and tell myself, is it in the Bible that we should sleep on our left side? Okay, if it is not in the Bible, written in the scripture, then I'm committing myself fully into God's hands. I'm committing this child fully into God's hands. I'm going to sleep in any position I want, so that when I wake up, I'm not going to wake up with fear that, hey, I'm not sleeping on my left side. Now my baby is going to be at risk. No, 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 no. That one is even worse. Anxiety and fear is way worse than whether you're sleeping on the left side or on the right side. So sleep on wherever position that it is comfortable for you. You can buy your pregnancy pillow for better sleeping if you have access to it, or if you're not comfortable while you're sleeping. And then don't worry yourself too much. Leave the rest to God to take care of you. Except if you now feel anything strange. Sometimes when you're now sleeping on that side, you now feel some discomfort. Try to shift immediately. Probably there's something going on. But as far as you feel no discomfort, you don't feel anything in your tummy, your chest, your breathing, you're fine. Leave it to God. Thank you so much for watching till this time. Please subscribe if you haven't, and please like this video if it has helped you at any point. Please do well to let me know if there are some symptoms I did not mention or some body changes that happened to you that I did not mention in the comment section. I wish you well. See you in my next video. Bye.